In this session, I will be explaining about stroke. Strokes are divided into two types. It means the brain is in a state of collapse. So, there is cerebral hemorrhage, and there is cerebral infarction. A cerebral hemorrhage occurs when the walls of the blood vessels become weakened due to a chronic lack of essential nutrients and end up bursting. So this used to be more common in the past. Back then, it was due to a lack of LDL, which made the blood vessels weak and caused them to burst. Nowadays, we call LDL low-density cholesterol or bad cholesterol, but in the past, this was considered a blessing. It was called cholesterol of mercy. Because of this, blood vessels wouldn't burst. So back then, it was considered good cholesterol, cholesterol of mercy. But now it's said that this only accounts for 5%. 95% are cases where the brain gets blocked, resulting in cerebral infarction. This is what we call cerebral infarction nowadays. So these days, cerebral infarctions occur frequently, and as you get older, it's said that your age plus your age is the percentage of your blood vessels that get blocked. What that means is, if you're 10 years old, it's normal for 10% to be blocked. If you're 70, then 70% blockage is considered normal. This means it's normal for them to get blocked like this. Now look here. Here's a blood vessel. It's blocked like this. So wouldn't you expect blood pressure to rise? Because the amount of blood flow doesn't suddenly drop drastically. But if you take blood pressure medication that causes your body to expel water, the viscosity of your blood increases. That means it gets stickier. Blood pressure, blood vessels. So then this blood, won't it end up blocking somewhere? Because it gets stickier. That's why medications like diuretics are considered good for controlling blood pressure. People say that lowering blood pressure reduces the risk of cerebral infarction or stroke, but cerebral infarction can actually become much more dangerous. Because the viscosity of the blood is high, something surprising happens. What I mean is, as Dr. Kondo's book says, the higher your blood pressure, the longer your lifespan. If you lower your blood pressure, your lifespan is shorter. What's one of the reasons for this? Since it's your age plus 90, as people get older, their hearts get weaker and can't pump blood to the brain. Wouldn't that cause a stroke? So, by raising blood pressure and sending blood more forcefully, cerebral infarction can be prevented. That's why blood pressure increases as you get older. But then, with blood pressure medication, blood pressure is suddenly lowered. A typical example of this is diuretics. They remove water from the blood. As the blood becomes thicker, the risk of cerebral infarction increases. The risk of cerebral infarction goes up. If your blood pressure is high, that's a serious problem. That's true for cerebral hemorrhage. If your blood pressure is high, a cerebral hemorrhage could burst, right? But if a cerebral infarction is blocked, you need high blood pressure to clear it. Isn't that right? So, and as for the cause, this is the cause, isn't it? The cause. So then, why does this happen? Number one, LDL cholesterol, low-density cholesterol that the liver delivers to the blood vessels. This is what blocks the blood vessels. Second is homocysteine. Methionine, which is a protein, is metabolized by vitamin B6 and becomes cysteine, turning into cysteine. We need to produce the components of our body, but how do we do that? If you're deficient in vitamin B6, it leads to homocysteine, which damages blood vessels, forms blood clots, and causes cerebral infarction. The third cause is calcification. So think about the skeletal system for a moment. People with severe osteoporosis, these people here, the calcium that leaches out from the bones wraps around the blood vessels as calcification, leading to arteriosclerosis, which can cause a stroke. For people with severe osteoporosis, it doesn't just end with osteoporosis. They call the calcium that comes out malignant calcium. The malignant calcium that leaches out here, accumulates in the blood vessels, forms calcification, causes arteriosclerosis, and this becomes the starting point of cerebral infarction. So people with severe osteoporosis also need to be careful about cerebral infarction. This is the rule. Next, the fourth one, blood clots. So what exactly was so serious this time? Whether you choose to get vaccinated or happen to catch COVID-19, whenever a foreign virus enters your body, your immune system immediately catches the virus, and that eventually becomes pus. Then it is tightly wrapped up by platelets, and what do we usually call this? A scab. That is precisely why we use the specific term blood clot. Your body naturally produces a great deal of these, whether you catch a common cold, get COVID, or receive a vaccination. They say blood clots don't form, but I've told you again that the antigen-antibody reaction is actually a blood clot reaction. The antigen-antibody reaction is a blood clot reaction. That's what we call it. If a blood clot blocks somewhere in the body, you die. So, for those who passed away at that time, it was because of these blood clots. Even in the US, they kept conducting tests and surveys, and the cause of death for all those who died was blood clots. Since blood clots form, let's not talk about strange, nonsensical things. Especially, imagine if these things overlap. Some people develop arteriosclerosis in their blood vessels, and then a blood clot forms and blocks them. They suffered from heat stroke. So there are people who pass away from heat stroke. Or there are people who, after suffering from heat stroke, become like this. How should I put it? They become sluggish or slow to respond. Some people even die from it. What is this? It's all stroke. What does that mean? It's not that people die from heat stroke because they're burned to death, right? From the heat? That's not it. Their blood vessels were blocked. For reasons like this, under heat stroke or stress, vessels are damaged. Sympathetic overactivity causes them to constrict. It's blocked, right? If this is the brain, you die instantly. People just pass away alone at night. So it's a combination of two things. If your blood vessels are blocked and your sympathetic nervous system is overactive due to stress, you die. That's why you need to be careful about the heat. Extreme heat is also a form of stress. If external stimuli or stress cause your sympathetic nervous system to become overactive, it's dangerous for people whose blood vessels are already blocked. There's something called sudden death during sex. It's called sudden death during sex. So, does that mean the person dies from pleasure while having sex? That's not it. It's more like this. Imagine that your blood vessels are blocked. They're blocked. Your blood vessels are blocked. But then you have sex. You know, when you ejaculate during sex. The sympathetic nervous system contracts sharply and triggers ejaculation. So your blood vessels suddenly constrict tightly. During ejaculation, your blood vessels tighten. If they're blocked like this, you die. You die. That's what sudden death during sex is now. A stroke is when a blood vessel is blocked. And what I'm saying is, if your sympathetic nervous system becomes overactive on top of that underlying condition, it's dangerous. Or if it's completely blocked, you could just collapse. So what should you do about this? You need to find the cause and eliminate these factors to be safe. It's not just about taking hypertension medication to lower your blood pressure and thinking you're safe. You need to understand the underlying principle to find the answer. And also,